call to order the October 26th, 2023 Health and Human Relations Committee to order. Welcome. I'm just going to say everybody's name so that for the minutes that we have in here, we have David Bramer, we have DJ Walsh, we have Dr. Scott Murphy, we have me, Jane Stormer, we have Amanda Chandler, and Kimmy Couch. And we have some community members, if y'all want to introduce yourselves real quick.
I'm Lisa Shelton. I'm affiliated with the Jefferson County Health Initiative.
Welcome. All right. So the minutes were sent out after our last meeting. Was everybody ever able to review them? Okay. So I'm gonna make a motion to approve the minutes as they were reviewed and sent out, or?
Can I second that motion?
Okay, I'm not gonna even ask if we need to change anything. We'll just do that. If everybody reviewed them. All right, next, I'm gonna change around the order of our agenda just a little bit, just to be kind to our community members and not have them at the end of our agenda. So we're gonna skip to step 5. Now that we're moving on from number 2 for time for public input. So Lisa, if you would like to give us your update.
I'd be happy to. Thank you for making that accommodation. Again, I'm Lisa Shelton and I'm a board member of the Jefferson County Health Initiative, which we're calling JEFCO. And I'm here to give you a brief update on the status of a couple of things, primarily the a feasibility study. We have felt, as we've explored the possibility of having a health and wellness center, whatever that entails, we feel strongly that to do a good job, we need a feasibility center, a feasibility study. And we have done some groundwork with various contractors, and I understand from Jane Williams, who's the vice president, that we have signed a contract as of today. The contractor is a group called Triangle 2. They're out of Nashville. And they have said they will have this done in 48 days. Now, I'm not clear on whether that's calendar days or business days, so I'm gonna go with business, which means it probably would be done sometime in January. What Jane told me, she's been doing most of the groundwork on this. She said the feasibility study will include a large survey piece to find out the community interest and needs as identified by the public, the gaps in existing services, potential users, the community's ability and willingness to pay for this. So we're going to try to find out if we can sustain something and what the gap might be, preferred location. And primarily for us, at least at this stage, is we want to know, as a board, we want to know, are we going to make this a YMCA or something else? On that point, we've done a lot of legwork dealing with the why. We continue to speak with them, but we haven't made that decision. So that's kind of where we are. I haven't been leading this effort, but I will try to answer any questions or I can get those for you.
So I think at the last meeting, when everybody was here,
Yeah.
there's talk about funding that feasibility study. Has that been?
It has been funded. There was a donation made and we're using that money to fund the feasibility study, which is great.
Good.
Very generous.
Then I guess a follow-up question. Somewhere I've heard that there's talk about a pool in the Brown Gym. Is that true? And if so, does that compete with this effort?
We've heard the same thing. And I think we're not there yet. Also, I think this is just my feeling. Once we know the level of interest, what people have in mind for this pool, I think we'll be able to assess if that's a good idea or not. Now, what I heard, just by way of information, was not necessarily a pool in the Brown Gym, but some sort of a health center, because it's right next to Crystal Beach.
Yeah.
So I don't know, that's out of our world. But, you know, we're certainly, well, we're just getting started. We're still listening. We intend to keep listening and happy to talk to you or anyone else to get more information. But yeah, and I don't know how the feasibility study will be done, but we certainly hope they'll contact you guys.
So, to kind of publicize this, well, at least get information out to folks and stuff. I mean, the county website would be available to,
Great.
to use that, and I can get you the information for get to call our admin assistant, because Sarah
Okay.
does so much more. Sarah Morgan, who runs our office, maybe it's familiar. So,
Yeah.
but
Yeah.
we'll get that information too, so you at least,
Wonderful.
I mean, I think using the city's website, and then Hanover's got one, so as many of those as we can populate the if it's a
Right.
survey or whatever is
Yeah, that's a
trying to
great
gather
idea.
information.
That would help probably Triangle also. I don't know how they operate frankly, but, no,
So,
survey is, a large number of people survey is what we're after.
so,
Do you know if the study will have a goal of trying to pinpoint a location?
That is one of the items on the list, and that list is not complete. I mean, we're happy to ask other questions. We want to know where people feel it would get the most use. And obviously downtown space, I don't know, there's some possibilities, some things we've worked around and tossed around, but nobody knows for sure. Ditto on the hill. I mean, we've talked about a couple of different locations, but we don't have anything firm.
Do you know, like the nature of it? Will it be a survey? Are they gonna be doing in-person interviews or?
I don't know precisely. When we first started looking at this, I heard about some phone stuff. They may be doing something more in person. I can find out for you. I do know that we're meeting, let me write that down. We are meeting with them we have 3 dates in November. Not sure we've settled on them. Early November, so really just in a week or so, to get more information from them about how they plan to conduct this, and they want to get our input on what we feel, some of the nuances, what we're trying to learn.
Yeah, and the kind of ditto Dave, like how it ends up, as far as getting communication out to broaden, as far as we can, where the outreach goes.
Okay.
We can, I know that your nonprofit is incredibly connected, but we can do what we can to broaden it even more.
Oh, I think it needs to be, I mean, you know, not me, but other people on the board have been here for a long time and they are connected, but that's not necessarily who we want to reach. I think there's a great interest on the board, and it's certainly my personal interest to make sure that we're including people who would not normally be included. And, you know, I know when a group of them went up to Shelbyville Y, and they were blown away by the kinds of services that are there, the ancillary services. Those are really enticements for people to come. They have childcare. They have, it's owned by a hospital. They have medical personnel on site. Wow. So those are all things to consider. If we could afford it, we can sustain it. That's hopefully what this survey is going to help us learn.
I'm curious, just in general, in terms of response that you've been getting from conversations you've been having in general, does there seem to be a lot of optimism and excitement about it? Or have you heard other viewpoints that are noticed and noteworthy?
They've only said good things to us. Of course, we're talking to each other. And I think that's that's something I'm really gonna be curious to see how well we're listening. But I think there are people we have to ask. They're not gonna be, they're too busy to, they've got 2 jobs or whatever. So that's the crowd I feel that we need to essentially find out what they need and then see if we can afford it.
Any other questions?
Great, thank you for your offer for the website, and then I'll get more information on the form of the survey and get back to you. Okay, if you think of anything else, feel free to, you've got my phone number, Jane. Yeah, great. Thank you again.
Thank you for the
Yeah,
update.
Thanks for coming.
Sure, thank you. Bye-bye.
Okay. And I don't think we have any more public input. You're here to observe, correct? Okay, great. Just want to make sure. All right, so next, is number 3, since we're jumping back to that. Commission members report on events attended in the last month and no upcoming events. Let's start with the first. I know we had 2 listening sessions, but did anybody else attend anything that they thought was noteworthy for the commission? Okay. I'm gonna scroll. I know that early in October, we had the BIPOC listening session at Eggleston School. I think what's interesting for both is that we did not have great attendance. I think that essentially means we need to shift how we approach these sessions. I think it's more about going to where people already are and events that are already happening, where people are having conversations, and not to just try to schedule our own. I think people are more comfortable with that. I think for the BIPOC session in general, we were hoping for a good turnout at the location, but there was just a really tough week for that community. There was a fire and a death in the community that really had everybody reeling, and we're exhausted, I think, of social events at that point. So that was a topic that did come up. While we didn't have anyone from the community show up, we did talk with the Madison HRC. A few of the members showed up to it. We had a conversation with them and with Shirley Klepper, who is essentially a representative of the Hispanic community. And she had some really good input, since she is very much having an ear to the community. And so I have a few notes over the things that were brought up in that kind of brief discussion we had. And anybody feel free that was there to jump in if I left anything out. The first thing that I have noted is that there's a great need for fire safety education and getting smoke detectors out in the community. There was some mention of some of that happening in the past, but it needs to be kind of reinvigorated. And also some concerns about fire hydrants that aren't operable, that kind of impacted the situation. And basically we're investing.
They were asking like, who's in charge of
that?
that?
Yeah.
Who inspects that, the fire hydrants? It's like, I don't know if that's water department or, I
I
wouldn't
think
think the
in that
fire
particular
inspector.
case, that organization that owns the housing development is responsible.
Is
for that.
responsible,
Yeah.
okay, so it can
Which-
vary depending on your location as to who's responsible.
Which particular case?
The fire for where the young lady died.
Was that, I'm not sure exactly where it was. I know it was at a trailer park, and that there was a hydrant, but it wasn't operational, and that was a delay concerns.
That's good.
I mean, not a good reason, but some collaboration with the local fire departments and housing developments should
Yeah.
probably be something they're trying to encourage that kind of.
Is that something we could do, or is that more of a commissioner task?
Yeah, I don't know the commissioner's task either, but we can encourage that
Encourage.
collaboration,
Yeah.
and maybe that carries some weight, we'll see. Sometimes it does, and sometimes it doesn't. But
Yeah. Sometimes it's
I think
just
the-
about following like, who,
yeah, the first part,
where
I think,
is the power?
I think we could, the education side, I think we can encourage that and get something going there. The collaboration may be a little more.
Mhm.
Mhm.
Can I ask a question about firefighting in Jefferson County? So I've only been here about 20 years, I'm still learning my way around. Is it all volunteer?
Yes.
So all firefighting is volunteer in the county or the city?
Yes.
Both.
Is there any agency that oversees firefighting?
Well, I mean, there's an association of the fire departments, and so they kind of police themselves. I think there's probably one over the city that's different than all the county ones, but they do try to collaborate with each other. I mean, they obviously have to work with each other, and they
Sure,
do
absolutely.
that. So,
Yeah. So would that, kind of overarching association, would it be them who we contact to talk about like education and smoke detector, availability and, kind of engaging with various groups in our community, especially
We
in.
have a fire chief, like
Yeah.
Bill DeVries.
New one now.
Oh, new one now.
I will tell you
Can you
that,
watch her?
so Madison Township and Rogers Ridge were out in Madison Estates last weekend where they had and they had information there, they had a place for them to sign up for
Oh, great.
smoke detectors.
Okay.
So they were already, and they had like a hot dogs and stuff like that, so they were trying to interact. I will say that they told me that the Hispanics are anxious about interacting with firefighters, so they were trying to encourage that, but they didn't. I think there's some of that because they didn't show up. They had the other, so that they hoped that they would, but that's part of what they were hoping to do, to like, we're here to help you, so. But, so I don't know.
Yeah. So maybe like the kind of pushing it further, trying to build that community.
The trust.
Yeah. They were trying to reach out, but
So was Rikers Ridge then?
it's Rikers Ridge in Madison Township. Yeah. I went out and took pictures of this weekend, so I was there, but.
It's good it's already starting. But yeah, I think continued is a thing because, it was mentioned that it's happened in the past, but it needs to keep happening. So I don't know if it was a change in leadership or something that made it not happen as often, or maybe it just wasn't time for it and they did do it, but.
I can remember at some point, like, there used to be different, like, giveaways for smoke detectors. If you needed one, you could contact local fire departments and stuff to get that. Or just even education on changing the batteries. and
Yeah.
I haven't really seen.
And to really target communities that have homes that only have one exit, that's the big deal with it, I mean, so.
Yeah.
All right.
Approaching one of those times, November 5th. Time change is usually the time they
Right.
encourage folks to change the batteries in the fire smoke detectors, so.
So who's somebody we can reach out to kind of learn more about what is happening, what is planned, and how we can encourage more? I'm kind of new to the community too, so I don't know everybody.
Well, we can, reach out to the Kenny Washer, who's the fire chief in Madison, but then there's like I said, there's a group of fire chiefs in the county, so we can get that information and then just reach out to them. So I don't know all the names of the chiefs, but I can get them.
Okay, so Dave's gonna do that. I'll make that an action step.
So am I right, there'd be like a need to fund the smoke detectors and then another need to distribute them to where they need to be to their final destination?
Yeah,
Those seem, am I right, those are two different endeavors?
yes, I would think so. I mean, I would think that there are plenty of opportunities funding wise for smoke detectors.
Yeah.
Out there, it's just finding that source and tying into it. They may know it already, so maybe in our discussion, they'll say, yeah, we've got them, we just, COVID has done a lot of things with getting out. I think now, more people are getting out, but just getting back into that habit of doing those things. And you have an instance where you do try to go out and it's just not,
Yeah.
the turnout's low and you're like, okay, we got other things going on, I'm sure, so.
Yeah, and it could just be a thing of, even if you're going to where they are, sometimes you have to go to where there's community already happening. Cause that kind of happened with us too, we went to the place, but we didn't go there when people are already there. We asked them to come, unfortunately during like a sectional soccer game.
Yes.
Nobody
That's-
came.
Yeah.
That was the other problem.
Didn't know they were gonna go
Not a
that far.
problem, just conflict. So yeah, there was already just a lot going on that week and then soccer on top of it with a lot of like the players being in the community. And so, yeah, I think that was a big part of it. So good. So we have, Dave following up, reach out to the chiefs to kind of see where they are and where we're going and what else can be done. As far as the hydrants goes, is that something that we encourage the chiefs to also follow up on with like the independent?
I think we'll see how we can work through that. They'd be the first guys to start that discussion. And see if maybe they've tried and not gotten anywhere. I would believe that they had, but I don't know, so.
Okay.
We'll check that out. We can talk to them about that.
Sure. Yeah, and if they need to, they could come here and update us at a meeting if they want to, or if they would rather just go through a separate conversation, we can just make that your little subcommittee right there. So, all right, the next thing that came up at that meeting was interpretive services in the county offices and jails, or perhaps to offer funding to people who volunteer their services for interpretation. Basically kind of circling around the idea that not everybody in the county is fluent in English, so when the jail or the courthouse or wherever the county's jurisdiction is kind of requiring communication, they really need some way to translate. And I think Shirley is a person who volunteers a lot to do that, but she's not always available. And she really wanted to see if there was some kind of more finite way to do that outside of just her. Cause I don't know if it's a
Like
sustainable
a lot
thing
of
for her.
counties have like, from my experience being in different counties, like a language line, there's a phone number, they call and can get an interpreter on the phone at least. And sometimes like when you call, you just tell them what language you need an interpreter for. I know when I was at KDH, I don't know if they still have it, but they had a contract with somebody and we had, like iPads on wheels and we're like FaceTime and interpretive service. So that could be used for more than like first ASL and then also for, there was a whole list of languages, some I've never even heard of.
Yeah.
I don't know what the cost of those kinds of things are, but I don't know all the laws, but might be one that we're supposed to provide that in situations. I don't know. I mean, at KDH, when I first started there, that was before they had that system. And they would, I'm fluent in sign language, but I'm not a certified interpreter. And they would pay me time and a half to come in and interpret until a certified interpreter could get there. So they would pay my nursing wage to come interpret, because it could take 2 or 3 hours sometimes to get a certified interpreter in person. I don't know, Buffer County officers and stuff.
Yeah.
Um,
And just as a, like an equitable means of like going through a system, I think it makes sense to look into it. Is that something that the county's looked into before?
They may have, I don't know of any efforts along that line. So
Okay.
that doesn't mean that there hasn't been.
Sure.
One of the things I recall was there also being like a gap in, there are translated forms, but often just giving them a form in their language is often a step that gets overlooked as a way to help folks be able to communicate at least what some of those more direct needs are.
Right. There's sometimes an assumption that because they don't speak the same language that they are illiterate, but they can read in their own language if given, provided with that, yeah.
So how should we move forward with that? Well, I mean, we probably can't solve every single issue that comes down.
Really?
Probably not.
At
But
least not in one meeting.
Not
Okay,
one
really?
meeting.
I can go and look and see what's,
Yeah,
maybe there are things out there already where people have tried, or at least have some things that we can. I mean, I think the biggest thing is just letting people know that it's available. And even then, it's gonna be, or just like, just the 2 examples you already had. I mean, having the listening session and having the smoke detector handout, I mean,
yeah.
you can do those things, but,
I'll turn that back on.
all right, that's fine. I was sure.
All right, well.
I mean, on our website, and I've tried Google Translate. I don't know
I've
How
used it
close it is?
before. It's close, but it's not perfect.
Yeah.
It,
so
it can quite often be wrong. So
Yeah.
I don't know if it would count if
When
it
I tried
was
it,
a legal obligation.
it was wrong, but there is an enable, and I thought we had that on the website, but, yeah, we can,
So I'll put you down that you're gonna look into what research has been done about it and
see if anything's been done.
see what,
Yeah.
what the next step might be.
Look at all the different languages.
Yeah,
But
I love Google Translate.
I know, but if you don't
But
know
it's
the
not
language, you know, if it's right or not, if it changes it, sure.
Yep. All right, so the next note was that health services for undocumented children offer emergency services only. So it's something in emergencies that's available for undocumented children, but otherwise it's hard for them to get any kind of service. So having low-cost care clinics would be really good. To get basic care at an affordable price, because that is the challenge. And Jeffersonville has the closest low-cost clinic.
And she was saying that, for the children who enroll in the Head Start program, any child who enrolls in it, they have to have a dental exam and vision exam within 95 days of beginning Head Start, and a medical exam within 45 days. And so they're often having to travel and coordinate all of that to get them to Jeffersonville to get low cost, exams. And then I talked to her too about just like sports physicals, you know, I know there used to be times, and I'm removed several years now from kiddos needing sports physicals, but there used to be times where you could go to the gym like one day and there'd be somebody set up that you could pay $15 or $20 or something. But I know the last year that my daughter did, we were able and insured and went to our family provider, but not everybody has that option. So
Maybe that's something we can send on as part of the
Well,
discussion for the.
For that other
health
group
center.
that's wanting just a health and community center, that is a need that could possibly be fulfilled there in the future, having a couple, even if they don't have full-time medical staff like in Shelbyville, what you talking about, but if once a month or once every couple months, there's these opportunities for that in the community.
All right. I'll put to follow up with Lisa about that.
I think we can probably also talk to Lindsay Warren and see what some of the new programs that can be developed with the new funding.
With the new funding.
Yeah, to see if there's some options there where it could be a mobile, medical facility or service that would come around, you know, every Thursday in the month, or I don't know, but just
Yeah.
something to help along those ones.
All right. I can follow up with Lindsay and Lisa about that. So I'll mark that as me. All right, the next was, kind of the same thing, eye and dental in a mobile clinic, because of the Head Start thing, so that was already covered, you can tie that in. I'll mark that. And then, the last one we got from the BIPOC session was that we need immigration lawyers to help people get green cards. Because a lot of people could qualify for green cards, but we just don't have, a lot of, Spanish-speaking lawyers, in the community that deal with, immigration law. Or immigration lawyers in general here. So that is a community need. There are some lawyers in Louisville that come up occasionally to do service, but one of them is retiring soon, so they see that service kind of not going away, but getting less available.
I have one other note from the session. So, have brought concerns at times with, racial profiling with traffic stops. And, the reps from the city, HRC was saying that they have had a city officer on their commission, and felt like maybe to help bridge gaps or hear those sorts of concerns when they come up. So I don't know if that's something that we want to consider or think about looking at as we change out some of our membership, of having a county officer or somebody joining our group. But she said that they definitely kind of see there'll be periods of time where it seems like there's more arrests or more traffic stops of those in the Latin Hispanic community. And Shirley said she calls up John when that's happened, John Wallace, but I don't know. Just one other thing that I noticed.
Yeah, and those fines can get pretty hefty.
Yes, and she was talking about, yeah.
Alright. And there's other kind of laws that stand in the way of that as well in Indiana about being able to even get a driver's license. Due to the type of the real ID, I think it creates an extra barrier for them, so.
Right, so she's saying some of them go to Illinois so they can get a driver's license.
Yeah.
So that's often they get a traffic stop and they get a citation for driving without a license, but there's so many barriers to getting a license, and so some of the people that she knows are leaving the state because they don't want to break the law, but they don't want to get to work or their kids to school or whatever.
Yeah. Any others from that one? The BIPOC session? The next one we had was the LGBTQ plus session. That was, I think, on the 12th. Yes, it was the 12th. And it too had not a high attendance, but we did schedule it to overlap with the PFLAG youth group meeting. So we did hear from some parents, and we did hear from a few youth who did come in later, as the youth group session was starting. So, we have quite a bit more feedback from this one. So we can go through these. And again, if you were there, feel free to jump in, if I'm missing anything. The first thing that was noted is that there has been some legislation from the state that is making people feel kind of othered or invisible or even scared to live in the state. And it's not that our commission can do anything about that, but to try to create environments where they do feel safe. The legislation, specifically, I mean, I'm not gonna say the actual bill number or whatever, but, that in schools, if a student wants to be called a name other than the name that's recorded, in their system, they have to get approval from a parent. Which essentially makes the student be outed to the parent when that could not be a safe situation for them. And that there is, a rule about no teaching about gender or sexuality in schools, which is definitely making people feel othered and overlooked. And then that the gender affirming care ban is in limbo, and it's making a lot of trans people in the community concerned. So that's another kind of state thing that is making people not feel completely safe in our community. The third thing was that, and it's just kind of a common thing we're hearing across the board in a lot of community, is that there aren't spaces for 20 to 40-year-old people to kind of come together and like just have fun, especially spaces that don't have alcohol. So it seems like there's just kind of like a gap in services for places for people to get together. And so maybe this health center will help solve that. And specifically for spaces that are welcoming to LGBT plus people in those age groups. PFLAG for people under 20 is that space. They have a space for them. And then like the Rainbow River Club for people who are like 40 plus generally have ways to congregate and join and have like events, but people who are 20 to 40 don't always feel like they fit into those spaces that already exist. So that is why kind of they brought up that specific age range as needing some way to find community. There was some notation about how businesses are supportive of some groups in our community. It seems to be super supportive of the Rainbow River Club, but businesses aren't always supportive of PFLAG, which is kind of an interesting kind of differential. There are many businesses that are not open about being supportive because they're afraid of backlash. Some are becoming very supportive and being leaders in the community. They mentioned the HH Apothecary is kind of looking like a space that is supportive and is very vocal about it and public about it. The next thing was that mental health care is an issue. And it was noted that it's an overarching issue, but this group in particular has special needs that aren't being met because local counselors often aren't affirming to gender identity. And so it would be really crucial to have some counselors, mental health counselors in our community, that can be affirming to gender identity and work with, people, who are non-binary, and who fit into the community in that way. And oftentimes they mention the same with healthcare in general. The next thing is something we probably can have a follow-up question on. There was a question about, if the health department can do more, and be more broadly available for programming, for HIV prevention, STI testing, and for contraception. They basically are just like, but we want to be more accessible and be more visible, in the community, so it's more kind of front of mind for the youth in our community and everybody in our community. So I guess that's something that we could follow up with Lindsay about as well, to kind of see what they have, what their plans are, and if we can kind of do more. Since I'm already reaching out to her, I'll put that on my plate.
I know World AIDS Day is December 1st, but I've never seen it observed here, so.
All right. Any other on that? Or thus far, anything people want to follow up on the comments that were made? It would be more.
With the health department thing, the last I knew, it was just 1 day a week that they offered STI testing, I think Wednesdays, and better by appointment. So maybe in asking, like, are there any plans, especially with this additional funding, to maybe expand that, and to maybe advertise a little more? Because I've been seeing the health department put things on their Instagram page about different things they have coming up. So it does look like they're trying to utilize like social media because, you know.
Okay.
I guess a clarification that I am curious about. I've heard, so you had said that with the legislation at the state about students who are asking to be called by different names. I've heard that they don't need parent permission, but parent notification
Oh,
is a component.
That could very well be it.
Okay,
I might be-
I had heard both things, and so I was curious if that was.
Yeah, I don't remember exactly how it was framed.
I think it was just that they notify.
Okay.
Right, that makes sense. That's a little bit better, but still not. No.
Still the same issue. Any others on the things that have been said so far? I didn't want to go through all 12 and then be like, so what you think? So, okay, so we'll do 7 through 12 now. So I think this is where these started coming in. We were hearing from them directly. Sensory rooms in schools were mentioned specifically as a space that is considered safe. So it's good that we're going to be talking about the mobile sensory unit a little later on in this meeting as an option that could help expand those services, because the person that mentioned it said that that was something that was available in middle school and that was like distinctly a safe space they remember. I do not believe they were in middle school anymore.
No, they're in high school now.
Yeah. It was also mentioned by some of the youth that it would be really good for them personally to see more churches being openly supportive of LGBT plus people in the community by displaying pride flags and affirming posters and safe space signs. I think what's surrounding that is that there's been a lot of discussion in the community around religious spaces regarding this topic, and it's just kind of at front of mind. So I know that we can't show up at churches with pride flags, or maybe we can, I don't know, but host maybe some education or optional kind of educational sessions in the future for people that want to engage with them. I don't know if that's something that we need to stew on a little more. I think probably.
Because also, I mean, just the separation
Yeah.
of church and
Yeah,
state
it's-
and where
We
do.
can't make anybody do anything.
Yeah, I think that's a little bit tricky there. I mean, as, like getting information out there, like Dave brings up often, like maybe there's some way to create a resource or suggest that they create one of what are, some churches
Mhm.
that, are openly accepting of any gender, sexuality, yada, yada, and
Yeah.
so that there may, maybe ones they're not aware of, or whatever, or maybe steer clear over here. I don't know.
Yeah. Yeah,
It's just a muddy
Yeah.
spot with us being a county commission.
sure.
Well, like,
Yeah, I think, I mean, all that we can do is listen and say it out loud.
Yeah.
That this is a concern,
Sure.
and that people are aware of it and want to feel more welcome in these spaces. So I think we'll think about that some more. I think we're probably gonna be looking in the future at some general programming that isn't focused on specifically churches, but to how to be more affirming and how to show that you're a safe space and that sort of thing, and how to approach it. I think it's a broader issue than churches alone, so I think that that's probably the way we'll have to approach it. The next one was that people were concerned about book bans. Because a lot of the banning is focused on removing books that are about them and people like them. And that's a concerning issue for them. It was noted that IB Tech is doing really well at including instruction about serving non-binary people in their healthcare classes. So they just wanted to kind of give a shout out that the classes they were taking in healthcare at IB Tech included like instructions on how to work with men and women and non-binary people in certain scenarios. Number 11, it was mentioned that that at KDH downtown, there is support for hormone replacement therapy. That people can go there for accessing hormone replacement therapy, but they have to have a doctor's prescription for it from out of town, and there aren't doctors in town that can provide that, or in the county, I guess, not just town. So, so while it's given some praise there, there's also some concern that our county has a segment of people that can't be served in our county. Number 12 is just a general comment
Can I
that.
ask on that? Do you
Sure.
know details? So, because that sounds confusing. There are physicians in town who can prescribe it, but they have to have a prescription.
So
Are they having to see a psychiatrist who makes a recommendation?
they have to see a specialist, I think in Cincinnati, to get a prescription. And once they have the prescription, they can bring it back to the hospital in Madison to have it filled and administered.
Okay.
I think those are the correct words.
Yeah.
Thank you.
So it was like Louisville, Indianapolis, or Cincinnati, so like the triangle around us serves, but not here.
Does that clarify?
I was just wondering why another doctor was prescribing to the doctor here, but like
Yeah.
maybe they prescribe like blood work or the administration of it, if it's something that's an injectable or if that's.
Okay. Good, I am not a healthcare professional. So, all right, and then the last one is that generally a culture shift is really needed in our community so that people can feel welcome in their own community. That was kind of the general consensus that that they're really hoping that there's a culture shift and wanting to see it helped along. All right. Any questions about those last sevens or input?
Do they have specifics about like the culture shift, like what?
I can say things that I've noticed personally are like, I think it, like at a local hardware store, just unprompted, a sign that's saying if you stand to pee, you're a man, period, for no reason other than that's my viewpoint. So things like that. I also think something similar was posted near like a grocery store as you're entering Hanover. But I think things like that, just for no reason, I want to offer this into public discourse, and it's really antagonistic.
Gotcha.
There's also some discussion of pride flags getting stolen.
Yeah.
And I think just in general, like there is a bit of shift happening. The stores are starting to include like
Stickers
the stickers
downtown.
down, yeah, and that's the direction they want to see people go in because they really need to see a visible sign. It's not something that you can just assume here, and that's part of the shift that they want. They don't, I think it's more of a, we'd rather there not have to be a sticker. But we need the stickers because of that.
Listen, visuals are helpful. I mean,
Yeah.
really, my friend from Australia, I nursed my kids, I did extended nursing, and she told me how there would be decals from outside of businesses that said Friends of the Nursing Mothers Association, and it's like, you just knew that you weren't gonna get harassed if you're feeding your kid while you're out shopping there. And so, cause there were times when people, just say stuff.
Yeah, they do.
So I can see how those visuals for other groups of people just trying to live their life and go, make them feel safer, so.
Especially at clothing stores, it was mentioned that like, if you're a non-binary person and you don't want to be harassed about what type of clothes that you're trying to buy, that having those stickers can be really helpful, knowing that it's a safe place for you to go buy whatever clothes that you want to buy and that sort of thing. Because that is a question.
Yeah, I also think that like hair establishments, like finding a barber environment that feels safe for them.
Yeah, the other piece that the youth were saying is they hit a certain age, and because there's so little community in Madison, they leave Madison. Their parents encourage them to leave the county. Like, that's the goal. You get to 18 and goodbye. Go to a big city where you'll be accepted. And the goal is to keep people here. We want Madison to grow and thrive and be diverse.
Yeah. I think I didn't write it down, but there was at some point some discussion about like the specific needs of this group that we need in general, like mental health is something we need in general, but this group specifically can see higher rates of suicide. So it's something that is like needed with an exclamation point, for this segment of the community. So to have people that can provide mental health care that are affirming, to help with that. And then beyond that, this group is often more likely to fall into, houselessness, because of not being accepted by family. And so there's a greater rate of people being homeless, in the community as well. So it's like a lot of the same issues we see for everyone, but just kind of at a much higher rate for this group and with more specific needs.
Yeah, it's hard because a lot of those issues, healthcare access, mental health access, housing, those are all problems for everybody. And, yeah, so that being more specific, that's hard.
Yeah, so I don't know if it's something when we are, talking about health in our community and we're talking about healthcare providers, can we talk with healthcare providers about, like, when we hire, can we hire for these things, but also with these things in mind, to support this community as well, because like mental health provider who can serve the LGBT community can also serve the straight community, the cis community. So it's not one or the other. There are people who can do both, and that needs to be a priority. Okay, any other comments on the listening sessions? I think as far as future ones, since we kind of discussed it probably happening again, and especially with the attendance not being awesome, one thing I was thinking is we should try to work in maybe a listening session during Black History Month. I know there's usually events in town at those times, and try to partner maybe with organizations that are already kind of doing education or doing conversations about these topics. We don't have to decide that today, because that's in February. But just on our radar, I think that's something we should be looking at as we get closer to February. All right. So I'm gonna move on to our next agenda item, which is commission members offer any new business. And the main things that I have, I'll go ahead and get this back on. I don't know, Cammy, while I get this going, do you want to talk about the sensory trailer training?
Sure. So Laurel Wall, who had came and talked to us about the sensory trailer, I followed up with her since our last meeting, and they have purchased the sensory trailer. They got the funding. They expect to have it here in Jefferson County in about a month. And then outward bound services, she said is available to assist with county-wide training, for like volunteers that would work the trailer during events or wherever they would be having it. And so just wanting, her question was asking if we want to be a part of the preparation or assist with plans to get that training going and available to folks across the county. So.
I think we told her we would help, so I guess.
Yeah, I told her, I didn't think it would happen this fast, but,
Do you
yeah.
know when, sorry, I was plugging in, I don't know if you said when.
She just said in the next month they should have the trailer. She didn't give any specifics as far as dates for training, but just said the outward bound, which, that's actually someone who oversees outward bound services, who connected Laurel to me, so we can talk to us initially.
So is is it that she wants us to do the training or us to help get people to the training?
She'd like both ideally,
Both,
I
okay.
mean, but I can follow up more on that and say, yes, we wanna help. What does that look like in your mind, our assistance?
You would think like if she's trying to set up some training to get folks around, that's probably not,
Fire truck or something.
not in the next couple of months, but maybe a little bit further, maybe early next year where we could, something we could advertise and get people aware of and get that. So if that's in line with what she's thinking, I think we can do it. I mean, we could try sooner, but I think it would just be like,
Realistic, yeah.
yeah.
And I would be happy to do the training myself, just because it's something that interests me. I would encourage anybody else who wants to do it as well, but I know I would have, gosh, I run into some triggered people and I would like to know how to help them out. So,
Just so I understand, so is the training just so that there's a general baseline awareness of how to support people who are having challenges with sensory over, or is it kind of cultivating like a volunteer base to assist, or like a yes and?
yeah, it would be helpful to know when we're like encouraging people to go, if this is just for general knowledge, or if you're going and putting your name on a list to get called to go work at events.
And I think something that she talked about when she was here is, or we did, I mean, the police and things like that, so some members of the law enforcement know how to.
So here's what I had sent to her.
Okay.
Good afternoon, I just wanted to touch base with you as I had heard that you had secured funding for the sensory vehicle and wanted to verify if that was true. Jefferson County HHRC is still very interested in helping to host a community training regarding the vehicle and other ways to make our community more sensory friendly. Thank you in advance. And so she had messaged back that they had got that. And then on October 22nd, she sent me and said, hi, we have purchased the sensory trailer and hope to have it in the next month or so. Outward Bound is available to assist with a county-wide training. Is your committee wanting to be a part of the preparations and assist with the plans? It is all moving fairly fast now with the sensory trailer.
If they need our help, I mean, it would help like plan it.
Yeah.
But you could probably have a meeting with them
Yes,
and with Outward Bound.
yeah.
To do that. We could just send out an email or put it on the county website, but we would need more information to do
Sure.
that.
Right,
Let's find out first.
Well, yeah, before I volunteer the county website.
yeah.
We just need more information about what it's
Sure.
gonna be like and the
And,
expectations.
they may have already talked about dates and stuff like that, so that's fine as well.
Their location and,
Yes,
And I think we can give her some bodies to do some things during the training or get ready for the training.
so my response to her just been that we were having a meeting tonight and I would
yeah,
go y'all and go back to her.
it was
So,
details.
okay.
Awesome. Yeah, we just need to know how we're gonna help and what the training's gonna be like. And so we can let people know what to expect when we help in whatever way they need.
Right.
Yeah, awesome. All right, so I met with Sarah Morgan. If you think that's all you needed. Yeah, okay. And we got some things together, for a website and some forms. This is an agenda request form that will be on the website that's attached to the county website. And this form essentially lets people, like Lisa, who came today, submit, information about something they want to add to our agenda. And it's just a brief form, talks about, their information, how to contact them, and a brief description of the topic. They can attach documents, And it asks them to limit their time to 10 minutes. So that our meetings aren't too long, as they can be. So if y'all look at this, is there anything missing or that you would add? It's very similar, I think, to the commissioners page. So it's built basically having already functioned on the commissioner's website.
Okay.
All right.
Are you taking like grammar feedback or?
Oh, we can.
I think on the bottom where there's like the disclaimer about, I think it's ensure with an E,
Okay.
because
It
like,
is.
Yes. All right. Let me get my
Good catch.
Good catch.
that was the only thing I noticed.
Okay, I'll scroll back up if you want to give it a double check.
Why is email address the only thing out in black? That just drives me crazy.
It's not required.
That's the only thing that's not required.
That's strange, because I would assume that it would be the only required
Requirement,
thing.
yeah.
Because that's how we might notify them that they're on the agenda.
People don't have an email address.
Yeah.
But name of organization doesn't have a requirement next to it, and that's still in red. It just would drive me crazy if I was looking at this website. My OCD would be like, but why?
Is there anything that we should make required? Maybe address so we can verify they're in Jefferson County? Or maybe not because if they're unhoused, like maybe not.
Yeah, I mean, do we need to know their address?
We could just ask, are you a resident of Jefferson County? Resident?
I guess we wouldn't not put it on there if they're not. Because it could be like an international student in college, it's here temporarily.
They would use the college's address, they
Yeah, I
wouldn't
guess
tell
that's
you
true.
it's, so,
Yeah.
it's like you said earlier, you don't want someone from out of the county coming in and giving us all this and
Trying to sell us
then,
something?
well, I don't know.
Yeah,
How about if you just put the email address in red and then everything's consistent?
okay.
Yeah.
Okay. Make it red.
Red font. Come on, for Amanda.
It's okay, color's important in visual design, so.
It's just strange.
All right, I'm gonna scroll through it again, just see if there's anything else. And this is all editable, so if we notice something later, we can always address it. Okay. All right, I'm gonna move over here. Here's the application. So, this is kind of like a mock-up of an application to be on the commission. For future commission members. I don't know if I mentioned at the last meeting, we have at least one commission member who is going to move in the next month or two out of state, so we're gonna need to replace her, and we may have another that, we need to pull in at another time and have somebody to replace now, so, so basically, this is just like an application, and some things we just put down to have on here, it's completely editable, it's not live. I just wanted to get feedback from y'all before we put it out there. And a little more time to work with it. So, name, phone number, and then email address and address. We do have a specific, do you reside in Jefferson County? Question there, because it is important, even if their address is in Jefferson County, they may not actually live here. You can have an address here and in other counties, so we just want to make sure. Then we have just a general tell us about yourself. What skills or experience can you bring to the Jefferson County Health and Human Relations Commission? Have you experienced discrimination in Jefferson County? If so, describe or experienced or seen. If you responded yes to the question above, from your perspective, what is the best way for the Health and Human Relations Commission to try to address this issue? As appointed as a Health and Human Relations Commission member, what types of projects and responsibilities would you like to engage with? Are you comfortable engaging with diverse groups? Tell us about your experience engaging with people of different races, religions, sexual orientations, educational and financial backgrounds. Then currently, the Health and Human Relations Commission meets monthly on the last Thursday of the month at 6 p.m. Would you be able to meet regularly at this time if appointed to the commission?
I like the questions. I think the length may be a barrier
Okay.
to completion.
All right. Which ones would you cut?
I'm curious if there's a way to maybe fold in maybe the discrimination question and maybe engaging with or advocating for diverse groups based off, I think that maybe there's some smart pairing. I don't have like any, I have to think on it for a bit,
Yeah.
but
How many people are we looking for our whole committee?
9 total.
Okay. How many do we
I
have?
think we have 7 on our, resolution, but I think it's 9 total. And right now, with the one that's going to move away, we're gonna be essentially too short. So we started full, but now we're gonna be too short.
So, just a little feedback, and I'm very open to be overruled. It seems like in a lot of these community service things, the challenge is to get people to volunteer. And this feels a little more like, I can't think of the right word, but the wrong word is hazing.
Yeah. It feels more like a barrier than an
Yes,
encouragement.
yes, and it also, I mean, I like the, I have to say, I like the blend of like this type of group. And I like that everybody's background, everything is not identical. My fear with the language there is that it might, number one, it might be enough of a barrier that nobody applies. Number two, those that would might be fired up and ready to engage in a fight. If that makes sense. I mean, I understand if I'm hearing that, my thought is that the heart of it is probably exactly not that. But like, can you scroll up?
Yeah.
Yeah, so have you ever experienced discrimination in Jefferson County? That's a hard one.
You
Because
leave
we
it at
do,
no, and do you feel like then
Say
you're
what?
gonna keep going on, or you can?
yeah, because we want to hear those concerns. Like these signs in the hardware store are grievous to me, right? But I don't, and I'm not articulating this well, but,
Is it more like,
there's so much social antagonistic volleyball going on in all directions that, it's almost like you wanna select out for people with some degree of conviction, but people that are capable of being calm. And there's a chance you'll miss the calm person with this. Does that make sense?
Yeah, I mean, I
I'm
think,
not saying it well.
I
And
think it's almost like, can we be a little more general to not like call out the discrimination, but like let
Maybe.
people volunteer the information in some way?
yeah,
I'm thinking some of these questions would be things that you would ask them in person.
Yeah,
Okay, you're interested, let's get you apply,
okay,
and then some of these questions you can ask them, and you can kind of see how the discussion is going. But I think those are things you wanna know, but maybe to get,
yeah.
so maybe like have an interview
sure,
as well as like
I mean, you know,
interview applicants,
I mean,
something
that's-
like we did
that's what
before.
we did, right, you know, I mean, because, and we got to know each other, and like, yeah, that's what. So, and I wouldn't, I'd hate to, you know, I'd hate to change it, because like Dr. Murphy said, I think we got a good group. I mean, we don't have, a whitewash one side or the other, you know what I mean? So I think we wanna keep that. I
Yeah,
mean, good chemistry is something that, I mean, businesses work very hard to get,
yeah,
and we've kind of got some good, I mean, we're still learning about each other and stuff like that, that's true, but I mean, at the same time, we've been able to talk about things that most groups that you brought together might not be able to talk about,
yeah.
you know, so.
Sure, yeah, and it's kind of like I mean, the resolution says that the people on the commission are going to be focused on these topics, and so we need to make sure that they are able to speak to them, are knowledgeable about them and that sort of thing, so,
And like I
that
said,
doesn't have to come up in this part. I think one thing I do wanna do now that I've thought about it some, because it's been about a month since I've been there. To not require it, but to leave the option to upload like a resume or a document if people want to. Because sometimes that's a more concise way to let people know about yourself. Does that seem?
Are you able to send this to us?
I can.
It feels like somebody's applying for a job.
But that is the problem, that's the only application, I've made applications for admission and for jobs.
I guess the thing is, I think
I
that,
like knowing if they live here, I like about the meeting times, because that was even, I was looking at that leadership program and that, in Jefferson County. And, you know, it was nice that they like specifically say, this is it, and then like, because it's during the day, you have to show them that your employer says, yes, you can as well. But those are good things to know up front,
Oh, yeah.
right? Because people can be interested in this group and volunteerism at all different levels, but then sometimes it just doesn't work out with your life and your schedule. So I
Yeah.
think that's good to be
Maybe we
including
can-
that.
I mean, I would think, you know, tell us about yourself, and then include, you know, you've got some prompts there. Okay, some of your skills, some of your experiences in Jefferson County, and you can leave it at that, and let them kind of.
I'm sorry, go ahead, I cut you off.
Well, that's all right.
Maybe an open-ended question like, why would you want to serve on this commission?
Just what I was gonna say.
That might like,
Yes.
because I can't stand this group of people, and I wanna make sure that there aren't any. You know, you might, I mean, that might identify, frankly, or, you know, I think that might be open-ended enough that it lets you see what you wanna see.
Yeah, yeah, I totally get that, no.
Yeah.
All right,
I still think interviews are good,
yeah,
and then, I don't know that it has to be the whole group, if it's just a couple people that go and interview, so they don't feel like, you know, it's them against everyone, they may not like that, and I understand that.
just thinking long-term, as 1 year people, like,
Well-
that's in less than half a year. So we really need to start getting our pool together so that we're ready.
but I would say, keep all of these questions as the interview template.
Oh, yeah.
Because I
Yeah.
feel like all of those
Yeah.
are like,
Okay.
yeah, like that's
Those are things.
what we would wanna hear, yeah.
So the first two questions, and then why do you wanna join?
Yep.
And then
worded
leave
more.
the time,
Yeah,
And leave the time.
leave the time.
yeah, that's true.
And then add a way to submit a file if they want to.
Mhm.
Don't require a headshot. Um,
No, because if you ask me to upload a resume, I
yeah, the
would
problem
have
is,
turned and ran.
I'm too good at making applications, which makes me bad at it sometimes. All right, cool. No, we can definitely do that. I think I just threw in all the suggested questions from last time that we didn't want to talk about.
Not that
So,
one.
yeah. So, yeah, I'll get with Sarah and we can update these. The other thing was, and we don't need this anymore for this, we have the website built, it's just a web page. And, essentially, like we have all of our information, like, hey, here are our names. We figured there's going to be a county email address for us that we can get contacted by, and we'll have this form where you can see who wants to submit, agenda request items. And then the other thing was, we needed feedback on frequently asked questions. We thought it would be good to have frequently asked questions. But I couldn't think in the moment of any questions. Because we're new. So I wanted to throw that out there to y'all.
What is an HHRC?
Yeah,
Like, just that simple. What is it that we do?
yeah, we're gonna
Why
have,
is it important?
we're gonna have a resolution on there, but people may not want to read through a whole
Can you
resolution.
make it like in layman's
Like,
terms?
make
Yeah.
it real short. And then like, maybe outline like what we can do. Like,
Yeah.
Our
'cause I
scope
think
of
that it-
power.
that
Well, and I
makes
think some of
voice.
the, like some of our guests in the past have had, there's been a couple I can think of that I think had unrealistic expectations of what we could do.
Mhm.
And, so yeah, that'd be helpful.
I mean, we've been posed the question by, I guess, more than once, what is y'all's budget? Same as yours. Yeah. So,
Yeah, so others. Because I can essentially take these and make answers to what I think it could be, and then give it to y'all so you can fix it. If that's how y'all wanna approach it, if that seems reasonable.
Sure.
Okay. I can email it out. And I will email out those, maybe I'll get with Sarah and have her update them, and then I'll send screenshots out of the forms with the updates. So we have, what is the HHRC? What can we do? What is our budget? Or is there a budget?
Would it be helpful to just like have the ability to just give some example of what has been discussed?
Yeah, what are some types of things that?
Yeah.
That we're
we've
working
been
on.
doing, been working on?
Community roundtables.
I mean, you would think, oh, they would just flow, but sometimes you gotta think about what sort of things you wanna do, so, maybe by next meeting, we should have some, you'll have done what you're gonna do, and then we can work on it.
Yeah.
Like, on the spur of the moment, you're like.
There's too much. All right. Yeah, if you think of any other, FAQs, let me know. Sometimes I do my best thinking in the car and I can't write anything down at that point. So let me know after you park. And then next, let's see, discuss future meeting date availability. That's something we kind of postponed to this week. I know Our next one is November 30th, which is fine for me. I think we saw that as a fine date. But then December 28th was a questionable one with the holidays. I know a lot of people travel on the holidays. Yeah, I typically am not either. Because none of my family is here.
I would rather not be. I feel like a lot of groups don't meet December and July.
It's
because
a
of
void of like, during that period, I just never know what day it is.
Right,
I was like, okay,
and you may not look at your email,
yeah.
right? So December 28th is,
3 days after.
yeah, 3 days after Christmas and 3 days before New Year's. So it's right in the middle of the gap, right in the middle. So yeah, I propose that we move that meeting to like January 4th, which would be the first Thursday of January. Is that better?
Yes.
I don't think we need to vote on it. We're just gonna,
Won't you have a commissioners meeting that night?
oh. Yes, check that.
There's some talk about moving them because those fall on Commissioner Lee's night shifts.
Oh, okay.
Let's put it as tentative
Tentative.
and we'll see. I mean, initially the schedule that was sent out, you're right. But I think there's some discussion, conflict. Right, can we move it? So probably what they'll do is move back a week. So the commissioner meetings will end up on the 11th and the 25th.
So our chairperson and our vice chairperson are already like, no, we're not gonna be around, so I don't.
What?
On the 28th, we'll have.
Oh, yeah, I'm saying put it there as
Tentative.
tentative on the 4th.
And if we have to, we can move it to the 11th.
Yeah, or we could just wait until
The
25th. I
25th,
mean,
okay.
we'll see, but I think, let's put it on the 4th tentative, and like I said, I'm pretty sure, based on discussions after the last commissioner meeting, that Ron was gonna propose that we move them back a week.
Yes. Cause yeah, January was a TBD to begin with, so I'll put down, it will either be January 4th, or,
25th. Or did you want,
yeah,
or the 11th, or the years later?
let's say the 4th or the 25th, depending on your
Okay.
schedule.
Okay.
'Cause if we start moving it in the middle of the month, then we'll have one like 2 weeks later and.
No, we just told them it's the last Thursday.
Yeah. Yeah, we don't wanna make it too funky. And then February, it would be the last Thursday is the 29th, so the last day of February. I'll let y'all look and see if you have any impending conflicts.
Yeah, I don't know, my wife's got plans. I'm just, and that's not a no, it's like a,
Yeah,
I'll plan around this.
Sure.
Kind of thing.
okay.
It's already in their calendar.
Mine too, it's a recurring meeting. And then that would be March 28th.
Still in my calendar. When is spring break? Do we know?
I do not, because I don't have children. Yeah,
I think it's before then.
okay,
Just so I have it down properly, were there 2 January meetings?
we don't know yet.
Okay.
I can say it out loud again.
I have the 4th as tentative.
Tentatively, we have it down for January 4th. But if there is a conflict with the commissioners meeting that day, then we'll just move it to January 25th. So it'll be one or the other. So either we'll do it on January 4th or we'll just skip the December one. And then. Closing by accident. I was scrolling through that. And then in April, it would be the 25th. That, I don't know, that may be my last one. I don't remember if it was April or May that was our first meeting. I'm gonna look back at that.
Does that mean you're not coming back?
I'll roll off as my 1-year appointment will end. I don't know how that works. At
That's
some
supposed to
point.
start practice year?
Gotta get the application done fast.
Yeah, why do you think I'm on this, y'all? We're gonna get this application done. Y'all gotta replace me. But I do want there, to be rollover, because we do want voices to cycle through and more voices in the community to come through, so. Yeah, it won't be like I disappear forever. Sometimes maybe I'll show up and ask y'all questions.
And we'll limit you to 10 minutes. Remind you of it.
I think April is far enough as far as tentative dates.
Sure.
Yep, okay.
Yeah, I've got to be for all years.
Right. All right, the next thing we have, time for public input, which we already did. We've just discussed the meeting dates for our next meeting, so November 30th, is our next one. I think the action items, for the next meeting, Dave is gonna follow up with fire chiefs, about fire safety education, smoke detectors, perhaps the fire hydrant question. Dave is gonna look into what research has been done for interpretive services and county facilities. I'm gonna follow up with Lisa and Lindsay about funding about possible funding for a mobile clinic. We're adding it to their plan for getting info about the feasibility study. And then I'm gonna follow up with Lindsay as well about what the health department is doing to expand STI testing, and if there's any further plans, with that, with the funding that they have from this week. Anybody else plan to have something they want to talk about at the next meeting? Or I guess we'll have, Cammie talking about what she hears about from the training from Laurel.
I have, Cammy will follow with our interest in offering support with the Century vehicle.
I had an action from last meeting about sending out the mental health
Okay.
presentation. I sent it out just before the meeting.
Oh, great.
You should see those now. That may answer some questions too about the other things on the.
Sure. Great, thank you very much. All right, well, if there is no other business, then I'm going to move to adjourn. I second that. Then we are adjourned.